Welcome back to Sports Extra, presented by Toyota. Today in the NFL, a number of players were checked for concussions. But what if there was a natural treatment to help delay or maybe even prevent the onset of CTE? In baseball, Yankees shortstop Didi Gregorius will undergo Tommy John surgery. Again, what if that same treatment could help Tommy John patients recover faster? Once considered controversial, stem cell therapy is more readily available and an alternative course of medical action. In this report, I met with an orthopedic surgeon that believes stem cell therapy is the future of sports medicine. Stem cells are being used to treat a wide range of conditions such as stroke, spinal cord injury, Alzheimer's, and Parkinson's disease. The stem cells are used to regenerate the human body without synthetic drugs or surgery.
The stem cells are harvested from placental cord material at C-section. There's no injury to the baby or the mother.
Dr. Brian Mehling, an orthopedic trauma surgeon, is the chief medical officer at BHI Therapeutic Sciences, the leader in stem cell therapy and research. At his Hackensack, New Jersey office, Dr. Mehling explains the process and where it's approved.
There is an FDA-approved, a couple FDA-approved stem cell treatments in the United States. So you can take the patient's own fat or their own bone marrow and you can concentrate it and administer the stem cells from that. But it's not nearly as effective as administering the cord blood stem cells.
The cost? $5,000 per injection. And because the cord blood stem cells aren't approved by the FDA yet, Dr. Mehling has been treating patients overseas since 2010 by traveling to clinics in China, Slovakia, or Jamaica for the injections.
By administering the cord blood stem cells, you're able to help that person recover a regenerative capacity that they haven't had since they're newborn.
Mehling's patients include those who have been in accidents, suffered spinal cord trauma, or other injuries. But many are athletes looking for options to heal without surgery, including competitive bodybuilder Anton Antipov, who traveled to Slovakia for stem cell injections in his knee and elbow due to injuries.
I injected his left knee and his right elbow with the stem cells, and then he did an IV infusion. And he had almost complete recovery. For me, I had a partial ACL tear and an anterior horn meniscus tear. But of course, I didn't want to have surgery. So I just did the stem cell injection without the surgery, and I had a full recovery.
Through research, Dr. Mehling sees promising results in the treatment of chronic traumatic encephalopathy, or CTE, the severe brain injury found after repeated concussions, a condition inflicting NFL players. His protocol would be a preventive therapy.
Perhaps the stem cells are helping your brain to really heal naturally, like perhaps the brain of a newborn baby has that capacity, okay? So that might help prevent the development of the disease if you started treating players early enough in their career.
Dr. Mehling, you've already talked about spinal cord injury, and now you've talked about CTE. What do you see as the future of stem cell therapy as far as treating concussions, specifically with these head injuries in football and in the NFL?
What I would propose to the NFL is to give every player a treatment at the beginning of the season, and then for all of the retired players, a sequence of 3 treatments.
Dr. Mehling believes stem cell therapy can be beneficial in treating all types of athletes, but especially football players who are susceptible to CTE. The goal is to have this type of protocol approved by the FDA, and then meeting with the NFL would be in order. Until then, he is treating his patients out of the country. Sports Extra will be right back.